What makes some HPV infections lead to cervical cancer? Imagine catching a common virus that most people get at some point, but only a few develop serious health problems. Human papillomavirus, or HPV, is incredibly widespread, but only a small number of infections turn into cervical cancer. So what makes some infections progress while others clear up on their own? The key lies in the type of HPV involved and how the body responds. Certain high-risk HPV types, especially HPV-16 and HPV-18, are more likely to cause problems. These are called high-risk HPV types because they have the ability to interfere with normal cell functions. When someone is infected with these types, the virus produces proteins called E6 and E7. These proteins are like troublemakers because they disable the body's natural tumor suppressor proteins, which normally keep cell growth in check. Specifically, they inactivate proteins called p53 and retinoblastoma protein, or PRB. When these tumor suppressors are turned off, cells can start to grow uncontrollably, which is a hallmark of cancer. But having HPV DNA in your cells isn't enough to cause cancer. For the virus to really cause trouble, its DNA often integrates into the host cell's genetic material. This integration disrupts normal viral gene regulation, especially the E2 gene, which usually keeps E6 and E7 in check. When E2 is broken, E6 and E7 are overproduced, pushing cells further toward becoming cancerous. However, persistent infection with high-risk HPV isn't the only factor. The immune system plays a big role. If someone has a weakened immune system, they might not clear the infection as easily, giving the virus more time to cause damage. Other factors like smoking, long-term use of oral contraceptives, multiple pregnancies, and other sexually transmitted infections can also increase the risk of progression. The location of the infection matters too. The transformation zone of the cervix, where the outer and inner cervical cells meet, is especially vulnerable because HPV replication is less controlled there. Over many years, additional genetic and epigenetic changes can accumulate in the infected cells, gradually transforming normal tissue into precancerous lesions and eventually invasive cancer. It's important to remember that most HPV infections are temporary. The immune system often clears the virus within a couple of years without any health issues. Only a small fraction of persistent high-risk infections progress to cervical cancer, and this process usually takes many years or even decades. In summary, it's the combination of persistent infection with high-risk HPV types that produce E6 and E7 proteins, along with host immune factors and additional genetic changes, that can lead some infections to develop into cervical cancer. This is why regular screening, HPV vaccination, and addressing risk factors are so vital in preventing cervical cancer. Always consult healthcare professionals for personalized advice and screening options to stay protected.